Hey everyone, it's Steve from Idaho Medical Academy here in Boise, Idaho. Today I'm going to break down the top 10 new phlebotomist mistakes and how you can avoid them. Whether you're still in school, newly certified, or just starting your first job, this video will help you draw with confidence. Let's get started. Okay, mistake number one, poor patient identification. What's the mistake here? Not confirming the patient's name, their date of birth, or matching wristband or requisitions and labels. Why is this a problem? It's the number one cause of dangerous lab errors. How do we avoid this? Always use two identifiers, such as name, spelling counts, and date of birth. Compare information on the wristband, requisitions, labels, and a verbal ID every time. If anything does not match, stop and fix it before you proceed. Mistake number two, skipping proper hand hygiene and your glove technique. What's the mistake here? Rushing into a draw without sanitizing our hands or changing gloves. You can probably guess, why is this a problem? Cross-contamination between our patients. We can't have that. How do we avoid this? Always wash or sanitize hands before and of course after each patient. Change gloves between every patient. If gloves touch anything non-sterile, change them again. Mistake number three, not positioning our patient correctly. What's our mistake here? Drawing from a patient who are standing, which is not advisable, or unstable. How do we avoid this? Always have the patient sitting with support or lying down. Utilize your armrest properly. If someone has a history of fainting, syncope, or if a patient looks faint or nervous, which you should be able to pick up on, draw them reclined or lie them down. Mistake number four, incorrect tourniquet use. Mistake here, leaving it on longer than a minute. You should know this, no longer than a minute. Tying a tourniquet too tight, painful, plus can cause hemoconcentration. Also flip side, too loose. If it's too loose, you're not going to get that vein to pop up to locate. Next, we'd be placing it too high or too low. How do we avoid this? Apply your tourniquet. Again, 3 to 4 inches above the site. You can use your hand as a measurement to make sure you're about that 3 to 4 inch mark. Tighten to where you can barely put your finger between the tourniquet and that patient's arm, and then you know it's nice and secure. If on longer than 1 minute during the selection, remove your tourniquet for 2 minutes, then reapply. Release tourniquets as soon as blood flow is established. Mistake number five, poor vein selection. What's our mistake here? Going straight for the small or deep veins just simply because they're in the antecubital area. How to avoid it. Start with the median cubital vein when possible. Then second, check your cephalic vein on the outside. Thirdly would be your basilic vein due to the nerves and artery. Avoid sidewalls, rolling veins, and veins near tendons. Take your time, palpating. Your fingers will tell you more than your eyes will. Mistake number six, wrong needle angle. What's our mistake here? Entering too shallow or too steep. How do we simply avoid this? Using a 15 to 30 degree angle when using the evacuated tube system, the ETS, and a 10 to 15 degree angle when utilizing the wing infusion set, aka the butterfly. Anchor the veins with your thumb. Don't jab. Enter smoothly and, of course, confidently. Mistake number seven, not following the order of draw. What's our mistake? Filling a tube in the wrong order of draw will cause cross-contamination. How do we avoid this? Memorize the order of draw. Keep a cheat sheet on your badge or a piece of paper nearby you can refer to. Practice until it's automatic. Mistake number eight, not keeping the needle steady. What's our mistake here? Moving the needle too much once inside the patient's vein. How do we avoid this? Plant your hand on the arm of the patient for stability. Hold the needle like you're holding a pencil, firm but gentle. If blood flow stops, don't sit there and wiggle the needle around. Simply withdraw the needle and try again. Mistake number 9, not communicating with our patient. Communication's everything. Mistake, staying silent or seeming rushed. How do we avoid this? Explain what you're doing. You're going to feel a slight pinch as an example. Encourage relaxation. Have them take a deep breath in and out. Patients who do trust you equals an easier, smoother draw. Lastly, mistake number 10, not labeling tubes immediately. What's our mistake here? Walking away before labeling the tubes or labeling away from our patient. How do we avoid this? Label at the bedside or draw station immediately after the draw, of course, after inverting our tubes. Always include full name of the patient, their date of birth, the date and time of the collection, and of course your initials, and any other required notes or barcodes you need to touch on. Remember, or keep in mind, don't rush your setup. Take that extra 10 seconds to prevent any type of mistakes. Thank you for watching. This is Steve from Idaho Medical Academy here in Boise, where your journey begins.